Our next presentation is Significant Heterogeneity in North American Pediatric Surgery Training Programs, a survey of the fellowship program directors, which will be given to us by KuoJen Tsao from UT Houston.
Good morning. It's great to see so many familiar faces. I feel like the first day back at school after a long summer vacation. So I'd love to share some of the work on the program directors that we've been working on for several years now. Am I going? You may or may not know that there has been an increasing rate of failing the certifying exam. Oops, is that me? And failing of the monitor. Okay, sorry about that. Increasing concerns about increasing failure rate of the certifying or the oral exam. And as a result, the program directors really wanted to take on looking into some of these factors. And what are the factors within training programs that really may contribute to some of this failure rate? When we really thought about it, it really is multidimensional. There are factors within the trainee themselves, the programs and how they educate, and certainly the exam has changed over time. But our main focus on this first effort was really looking at the curriculum and the educational experience for the fellows. So we did a pretty long survey of program directors and associate program directors. We asked questions about their fellowship in regards to their clinical exposure, their fellowship logistics and structure, and the educational curriculum. They provided in-service scores anonymously, as well as their case volumes and their exposure clinically. This was all self-reported from the program directors, and we look at its correlation with the qualifying as well as the certifying exams. We asked specific questions about fellowship characteristics. We looked at the number of fellows, any other additional fellowships that were within their programs. We want to know about the clinical exposure, the case volume, the call burden, their educational curriculum, didactics, conferences, any courses that they might be taking, and then the overall program in general surgery. What's the case experience like, any exposure to any specialization? As a result, at the time of the survey, there were 58 programs that were live. We excluded one that just came online. 2 opted not to participate, so we had a pretty high response rate. Not all the respondents answered every question, and some of the answers were multiple for a lot of the programs. About half the programs actually were only the traditional two fellow programs. Only about 2 programs existed that had 3 fellows, alternating between 2 fellows and 1 fellow every other year. We want to know other subspecialization or other subspecialty fellows that existed. 3/4 of the programs actually had some other fellowship going on, and many programs had more than one. Critical care was the most popular, but as you can see, there was a lot of other subspecialization that was represented in these other clinical fellows within programs. We asked about the call schedule and the call burden, which is actually really hard to kind of figure out. We got all sorts of answers, different permutations, long paragraphs describing how their fellows took call. As we sorted through it, it kind of boiled down to 1 call in every 4 nights. About 2/3 of those were in-house. We wanted to know about their critical care experience. We asked about their exposure to NICU and PICU. And for the most part, the fellows rounded daily with multidisciplinary teams in the NICU on a daily basis or most of the time. But there were a few programs that they rarely ever rounded with the NICU and only did it when they were on that rotation. We found similar experience in the PICU as well. There were a lot of conferences that the fellows were required to attend, but we could not confirm whether that they attended those or not. Dr. Powell will be happy to note that the score in the NAT were the educational resources of choice. And we want to know about the program. On average, programs were about 24 years in existence, but there was a fair amount of programs that came online in the last 10 to 15 years, as you can see. We asked about their faculty complement. On average, there was 8 faculty per fellowship, median about 8. The bulk of those were in that 5 to 15-year range of out of training. And then the programs actually reported their caseloads and the total exposure of their programs. So on average, the caseload was about 2,700 cases of general pediatric surgery in which the fellows participated in when you looked at the faculty and what they did. I think this is a little bit skewed. As you can see, 13 programs only existed above that median line. Most of the programs were way below that 2,700. When we looked at all this data and tried to analyze it and its associated with the qualifying exam, we actually found no characteristics in all the variables that we looked at for the qualifying exam. When we looked at for the certifying exam, the oral boards, only a higher P-site score was associated with passing the certifying exam. So in conclusion, pediatric surgery training I think is pretty complex. It's multidimensional. We found a lot of differences in programs about their fellowship structure, their clinical exposure, and their educational curriculum. The program directors are working pretty hard now in trying to establish some best practices, maybe some national guidelines on how we can build curriculum. But certainly this is a challenge for all of us as we try to optimize pediatric surgery training. This is the crew that worked on this, and I'm happy to answer any questions. Thank you.
Barb Gaines. First, I want to congratulate KuoJen and his group for doing this. This was a huge lift of trying to understand a really complex system. I think some of the things that were really interesting is that there were some biases that we all had going into this, new programs versus old programs, one fellow programs versus two fellow or more programs. And I think what was interesting is that some of those biases proved not to be what we thought they were going to be, and that it's probably a little bit more complex than new programs versus old programs, legacy programs versus newer programs, and so on. I guess my question for you, KuoJen, is when you're thinking about sort of the standardized curriculum, are you thinking about a standardized didactic curriculum, or where do you see this going next? What are you going to use this information to help guide the next steps of your group?
You know, that's a really great question, Dr. Gaines. I think looking at all of this, learning a little bit about how other programs function, and maybe even thinking about my own program, we certainly have gaps in expertise and knowledge. And is there a way that we can help other programs fill some of those gaps, at least from a didactic or someone mentioned yesterday, like a master surgeon level? Are there certain best practices that we should be doing? Journal clubs, case studies. And it was pretty clear that not everybody did the same thing. And I think that's probably one of the first things that we need to flesh out is, you know, are there things that we can do as best practice as educators?
Upperman, Vanderbilt. KuoJen, excellent work.
Thank you.
We looked at this question a couple years ago about the educational training of the program directors as a surrogate for their faculty. We found there was really only a couple who had masters of education. Do you see some room there for some professional development for the faculty as well as program directors on how to be sort of master educators? Please come.
Yeah, I think that's another great question. I feel like you're calling me out, but that's okay, because I would call myself out as well, because I'm not a professional educator. I'm a pediatric surgeon that loves training fellows and teach them the only way that I know how I was taught. And I think certainly there are gaps in knowledge on how to do adult training. We have sort of technical skills that we teach, we have knowledge skills, and we have human skills that we have to teach every day. And I think those things require expertise like everything else that we do. And I feel like more and more people joining APSA, the younger members, are getting their masters in education. And we really need to take advantage of that and bring that to this group so that we can do a better job of training.
Thank you. Sorry.
Yeah.